up in Northeast Tennessee in the rural community, I mean, those folks deserve access to care.
State Representative Gary Hicks of Rogersville making the argument to fellow lawmakers in Nashville Tuesday afternoon that Tennesseans should be able to purchase the home medical equipment they need, even if the provider doesn't have an office in Tennessee.
It's not about just passing legislation for the sake of passing it. I mean, this issue happened to a family there in Hawkins County. And so, we're trying to get legislation that's going to really benefit citizens of Tennessee.
Tennessee law prevented Quinnlee May's family from purchasing a ventilator she needed to be able to come home, one made by a New York-based company that didn't have an office in Tennessee. After weeks of requests, the family eventually got special permission, an experience they don't want to happen to anyone else.
We're hoping that somebody will work with us to make sure that nobody else goes through this. If you go to the hospital and you need something, you can just get it and come home. You don't have to jump through all these hoops.
Hicks' bill would remove the portion of the law that requires a company to keep an office in Tennessee in order to sell medical equipment.
Quinnlee's law provides more access to care by removing the requirement that a provider of home medical equipment services
Quinnlee passed away on Friday, but Hicks says the bill carrying her name is building support to pass into law.
Her legacy is going to live on many different ways, but one way, one of the ways it will is through this piece of legislation that is named after her.
The funeral for Quinnlee Schreiner will be held in Kingsport tomorrow. Hicks said the bill will likely be before the full health committee next week. Sarah, Josh.
All right, Kathy.